Muy
afternoon
buenas
and
tardes y
welcome to the
bienvenidos
April
a la
30th
actualización
Community
comunitaria
Update.
del 30 de abril.
My name is
Mi nombre
Stacy
es
Wood,
Stacy
and
Wood
I'm a
y
Public
soy
Information
oficial de
Officer in the
información pública
Emergency
del Centro de
Operations
Operaciones
Center.
de Emergencias.
First, I want to
Primero
recognize
quiero
the people that are
reconocer a la
working to
gente que
make sure
está
that the
trabajando para
information that we
asegurarse que
share
la
in these
información
updates,
que compartimos
as
en
we're
nuestras
trying to reach our
actualizaciones al
Spanish-speaking and
tratar
deaf and
de
hard of
hacer
hearing
alcance
residents
a
are
las personas
recognized.
que hablan español y a
So
aquellos
thank
que
you
son
to
sordos o
Spanish
que tienen
interpreters
dificultad
from
para escuchar.
Sinsatle
Así que muchas
Language
gracias
Justice
para las
Cooperative
intérpretes de
and
la
to
Cooperativa de
the
Justicia y de
American Sign
Lenguaje
Language
Sensontle
interpreters
y a las
Ashley
intérpretes
Kervolka
de
and
señas
Regina
Asheville
Pente.
Kirbica y Regina Pente.
This community update
Esta actualización
is available in
comunitaria está
Spanish
disponible en
on the
español
Buncombe County
en
Health and
la
Human
página de
Services
Facebook
Facebook
de
page,
Servicios
and that can be
de
found
Salud
on
y Servicios
Facebook
Humanos del Condado de
at
Buncombe, en Facebook
BCHHS.
@BCHHS.
Today's updates come
Las
from Dr.
actualizaciones de hoy
Jennifer
son de la
Mullendor,
doctora Jennifer Mullendor,
Interim Public
directora
Health
médica
Director,
y directora interina de salud
Brownie Newman,
pública,
Chair of the
el
Buncombe
señor
County Board of
Brownie Newman,
Commissioners,
presidente de la Junta de
Esther
Comisionados,
Mannheimer, Mayor of
Esther
Asheville,
Meinheimer, alcaldesa de Asheville,
Fletcher Tove,
Fletcher Towe,
Buncombe County
director de
Public Health
preparación de
Preparedness
salud
Director,
pública,
and Dr.
y
William
Dr.
Hathaway,
William
Chief
Hathaway,
Medical
jefe
Officer for
ejecutivo
Mission
del
Health.
Hospital
And
Mission.
today we will get
Y
started with an
vamos a
update from Dr.
comenzar con
Mullendor.
la doctora Mullendor.
Good afternoon.
Buenas tardes.
As of noon today, there have been
Tenemos
68
68 casos confirmados de laboratorio por el COVID-19 en residentes de Buncombe.
Since we last spoke,
Desde que
we announced an
hablamos,
additional
se ha
fatality
añadido una
associated with
muerte
COVID-19
más
on Tuesday.
el martes relacionada con el COVID-19.
Behind these case
Detrás de
numbers
cada
and
caso de
fatalities are mothers,
muertes hay
fathers,
madres, padres,
brothers and
hermanos,
sisters,
hermanas y amigos,
husbands,
maridos y
wives,
mujeres
and
y
friends.
amigos.
Every case
Cada caso
and every
y
death
cada muerte
leaves a mark
deja
on
una
our
marca en
community.
nuestra comunidad.
This
Y
is
por
why
eso
we are
estamos aquí
here
hoy
talking with you today
hablando con ustedes
to express
para
how
expresar
serious
lo
COVID-19
serio que es el
and
virus
how all of us
COVID-19
can
y
continue to do
cómo
our
todos
part
nosotros
to
podemos
slow the
continuar
spread
haciendo nuestra
in our
parte
community.
para parar el brote en nuestra comunidad.
Today we have several
Tenemos
new and exciting
nuevos
developments to share with you.
actualizaciones que queremos compartir con
The
ustedes.
first
Lo primero
is the Buncombe
es el
County
condado de
COVID-19
Buncombe ha
data
sacado
dashboard.
una base de datos
Second is the
y
expanded list of
que se
symptoms.
van hasta los segundos que
COVID-19.
se expanden los síntomas del COVID-19.
Third is the
Y
Buncombe
la
County
tercera es que
COVID-19
el
self-checker.
condado de Buncombe tiene una
And
nueva aplicación de
finally,
autorrevisión y
additional
finalmente
information on how to access testing for
más
COVID-19.
información de cómo hacemos las pruebas del
So
COVID-19.
first,
Entonces, lo primero,
for the data dashboard
sobre
that's
los
now
datos que
available on the
ahora está
county's
disponible en la
COVID-19
página
website.
web del condado.
This dashboard includes
Este
information
tablero tiene
on lab confirmed
información de casos
cases of
confirmados del
COVID-19 in
COVID-19
Buncombe County
en
residents
residentes de Buncombe
by date that their
por la
test was
fecha que
collected.
se les hizo la prueba.
The demographic
La información
information
demográfica
that we've previously shared on cases is available as well.
los podremos compartir según la tengamos en cada caso.
The dashboard
Este
also shows the
tablero
number of
también
tests
muestra el
for
número
COVID-19
de
that have been
casos
performed
de
on
pruebas que
county
se han hecho en
residents and reported to
residentes
Buncombe County Public
y
Health.
que nos han informado
At this time, the testing data shown
estos
here
datos que
does not
se
include
muestran
tests
aquí.
conducted in-house
No
at
se
Mission Hospital,
ven los que se han hecho
which
en
has
el
been
hospital de
almost
Mission, que han
300
sido
tests to
300
date.
casos a fecha de hoy.
We are working on getting that information
Estamos intentando actualizar y poder
the
añadir
dashboard.
esta información al tablero.
added. So when I do all the
Entonces,
math,
cuando yo hago
currently we
esta
are aware of
información,
almost 2,600 tests that have been
tenemos
performed on county
2.600
residents.
casos que se han hecho en el condado de Buncombe.
Second, I want to talk
Y
with
lo
you about the
segundo que quiero
symptoms of
hablar es de
COVID-19.
los síntomas del COVID-19.
If you
Si se
recall,
acuerdan,
for weeks
durante
I've been mentioning
semanas he
fever,
estado mencionando fiebre,
cough, and
tos,
shortness of breath.
respiración corta,
However, earlier this
pero
week,
esta
the
semana el
CDC
CDC
expanded
lo
the
ha
list of symptoms
expandido
of COVID-19
los síntomas del COVID-19
and
y
recommends
recomienda
that individuals with the
que
following be
individuales,
evaluated
que
for
personas con
testing.
estos síntomas que sean
So we
evaluados.
still have cough
Entonces todavía tenemos la tos
and shortness of
y
breath or difficulty
dificultad de
breathing.
respiración
Now they also include at
También
least 2
dice
of the
más de
following
los siguientes
symptoms:
síntomas:
fever,
fiebre,
chills,
escalofríos,
repeated shaking with chills,
como un temblor con escalofríos que se
muscle
repite,
pain,
dolor muscular,
headache,
dolores de cabeza,
sore throat,
la garganta
and a new
seca
loss of taste
y
or
como una nueva
smell.
pérdida de sentido y de
It
olor o
is
gusto.
important
Y es
that
importante que
anyone with
cualquier
these
persona con
symptoms
estos
be
síntomas
evaluated for
se les
COVID-19.
sea evaluado para el COVID-19.
And the next thing I want
Y
to
lo
talk to you
siguiente que quiero
about,
hablar con
the Buncombe
ustedes
County COVID-19 self-checker,
es
is a great way to
lo que
start the
tenemos
evaluation process.
de la autorrevisión y es una nueva forma para empezar este proceso de
This
evaluación.
self-checker is now
Este
available on the county
autorrevisión está
website,
disponible en la página web del condado
and it's a
y
confidential
es confidencial,
quick
es rápido, un
system
sistema
that will
rápido
provide
que
clear
te
guidance
dará unas
for
pautas
anyone who thinks
para
that
cualquier
they may have
persona que piensa que
COVID-19
tiene el COVID-19
and needs assistance
y
with
que
finding
necesita
testing.
asistencia a la hora de encontrar, de hacerse
It
las
also
pruebas.
will
Y
provide
también nos dará
data
unos datos
that will help
que
us
nos
as a
ayudará
county
como
know more about
condado
what's going on in the
ver qué está
community,
pasando en
how many
nuestra
people
comunidad,
have
cuánta gente
symptoms,
tiene
and
síntomas
will provide more
y nos dará más
information to help
información
us
para
through
ayudarnos
our phases of reopening.
evaluar cómo se hace
So
la
here's how to
desescalada.
use the
Y
self-checker.
así, entonces aquí les voy a explicar cómo se va a usar.
First, go
Entonces
to
primero tienen que ir a la página web de buncombecounty.org/COVID-19
and click on the COVID-19
y hagan
self-checker
clic en donde pone
banner button.
self-checker,
Follow the
autorrevisión.
prompts to share information about your
Y entonces ahí
health,
puedes compartir información sobre
any symptoms you're having,
tu salud,
and your health
los
history.
síntomas que estás teniendo y tu historia sanitaria.
If your results
Y si
indicate
tus
that you
resultados
need
indican que
testing,
necesitas hacerte la
we
prueba,
will
te
connect you with
conectaremos
testing
con
and
la
other
forma de
support to
hacer
keep
las
you as
pruebas
safe
y
as
cualquier tipo de
possible.
ayuda para mantenerte a
If you have
salvo. Si tienes
symptoms, we will
síntomas,
continue to follow up with
seguiremos
you every day for 7 to
hablando
10 days
contigo
after you complete
diariamente
the self-checker.
por todos los días hasta 7
We
10
want to make
días.
sure that everyone in our
Queremos
community
asegurarnos que todo el mundo en nuestra comunidad
is getting the care that they
tiene el
need.
cuidado que necesitan.
You can also use
También
the
puedes
self-checker by
usar esta
calling the
aplicación
Ready
para
team
llamando
at
al equipo que se llama Ready Team al
828-419-0095,
828-419-0095 y
Monday
de lunes a
through
viernes de
Friday,
8
8
a
a.m. to
las 5:30.
5:30 p.m. I encourage
Les
everyone to
pido
use the self-checker
que
if you
todas las
believe you
personas que
might have
deberían usar la
COVID-19.
autorrevisión, esta aplicación en nuestra página web si crees que tienes algunos síntomas del
And finally, let's
COVID-19.
talk a little bit about
Y al
testing.
final vamos a hablar un poquito más sobre las pruebas.
So as I've mentioned
Como ya les he
before,
mencionado,
we have
tenemos
primary care providers in the
Tenemos
community, urgent care
cuidados en nuestra
clinics
profesionales
who have
médicos
been
en nuestra
and
comunidad
continue to
que
conduct
están haciendo estas pruebas y que
COVID-19
siguen
testing
haciendo estas pruebas del COVID-19
on individuals with
a
symptoms.
individuales que tienen síntomas.
Testing is
Estas
available to
pruebas están
everyone,
disponibles para todas las
regardless
personas
of race,
sin
income,
depender de
gender,
género, de
ethnicity,
ingresos, de etnicidad,
citizenship status, or
tu
religion.
religión o tu estatus.
If your primary care provider does not
Si
offer
tu profesional
COVID-19
médico
testing,
no te ofrece este test del
there
COVID-19,
are other
hay
options in our
otras
community.
opciones en nuestra comunidad.
Mayhex Family Health
Mayhex
Center
Centro
off Hendersonville
en
Road,
Hendersonville Road, en la carretera
Mercy
Hendersonville Road,
Urgent Care
Mercy
centers
Urgent
throughout the
Care
community, and
y
Rage Urgent
Rage
Care
Urgent Care
have expanded
están
testing
expandiendo sus pruebas
at this time.
hacia el público.
We anticipate that
Anticipamos
additional
que
partners will come on
más
board
otros
as
centros
testing supplies
médicos
are now more readily available
también podrán pronto
and guidance for
facilitar
providers has changed
estas pruebas,
to encourage more testing.
ya que las pautas han cambiado para que se puedan hacer más pruebas.
At this time, the county does
En
not
este
plan to
momento,
offer any
el condado
drive-through
no
testing
está
sites,
planeando hacer
but I'll say
ningún
no
tipo de
options are off the
pruebas que
table
sea
as we see what
manejando,
continues
pero
to occur
también
with this ever-evolving situation.
todo esto se está volviendo a replantear y equipo de cambiar en
We are
cualquier
working
momento.
with additional
Estamos
partners to
trabajando
explore
con
further
otros,
testing opportunities,
con otros profesionales para
including
que puedan también hacer las
getting
pruebas.
testing out into under-resourced
Y
areas of our
estamos viendo cómo
community
podemos dar esas
through our
pruebas a
federally
la
qualified health
gente
centers.
en comunidades más, con menos recursos.
Information about testing
Información sobre
locations
localizaciones de
can be
pruebas
accessed through
lo
the
pueden
self-checker
ver
and is available at
tanto en la
buncombeready.org.
aplicación de autorrevisión como en la
If
página
you
web
have
de
private insurance,
buncombeready.org. Si tienen un seguro privado,
payment for
los
your
pagos
COVID-19 test and
para tus
for an office visit
pruebas
should be
debería
covered
estar cubierto
by your insurance.
por su seguro.
If you are
Si tú no
uninsured,
tienes un seguro médico,
the CARES Act,
el acto de
CARES,
CARES
from the federal
y el
government
gobierno federal
may be used to cover the cost
puede que
of
cubra, se puede
clinic visits
usar
and
para
testing
comprar
for COVID-19.
para este cargo.
And some of the providers that I mentioned above
Y
offer
como
charity care
unos,
assistance or sliding scale
como los profesionales
options
médicos
for payment.
que anteriormente mencioné también tienen una escala
We
de
encourage you to
pagos
check
o
with your
gratuitos.
provider about these
Entonces,
details.
por favor, pregunta con su profesional médico sobre todos los detalles.
So please continue the good work that
Entonces,
you've
por
all
favor, sigue
done,
con el trabajo excelente que
staying
estamos
home and staying
haciendo
safe,
de la distancia física, quedándote en
keeping your
casa,
physical distance,
mantenerse seguros en casa,
but staying engaged.
tener la información
Keep washing
apropiada,
your
sigue
hands,
limpiándose las manos,
cleaning, and
limpiando,
disinfecting frequently
desinfectando
touched surfaces.
todas las cosas que se tocan a menudo.
Check out the
Y
resources
mira los
that I mentioned
recursos que he
today on our
mencionado hoy
website.
en nuestra página web.
And together
Y
we'll
juntas
learn more about what's going on
vamos a
in the
aprender
community
más
related
de
to
lo que está pasando en la
COVID-19
comunidad relacionada con el COVID-19
and work
y
to
trabajaremos
prevent further spread
para
through Buncombe County.
mantener
Thank you.
estos contagios en el condado de Buncombe. Muchas gracias.
Good afternoon.
Muy buenas tardes.
I'm Brownie
Soy
Newman, Chair of
Brownie
the Buncombe County
Newman,
Commission.
presidente de la Junta de
On
Comisionados
March
del Condado de
12th,
Buncombe. El
Buncombe
12
County
de
declared a
marzo,
local
el Condado de
state of
Buncombe
emergency to prepare for the
declaró
threat
una
of COVID-19.
emergencia del estado por el
At that time, there
COVID-19.
were just 2,200
Habían
documented cases of
2.300
COVID-19 in the United States.
casos en los Estados Unidos.
Now, just 49 days later,
Y 30 días después,
there are
ahora
more than
hay
1
más
million
de
documented
1 millón
cases
de casos
and more than
documentados
60,000
y más
people
de
have lost their
60,000
lives
personas
as a
que
result
han
of
perdido sus
COVID-19.
vidas a causa de la COVID-19.
Fortunately, here in
Afortunadamente,
Buncombe
aquí en
County,
el condado de Buncombe,
the number of people who
el
have
número de
become
gente que ha
seriously ill
estado
as a result of
bastante
COVID-19
enfermas
is
como
lower
resultado de
than
la
most other
COVID-19
metropolitan areas
ha
across
sido
North
menor
Carolina and
en
across the country.
Carolina del Norte, porque no
Local
es
residents,
metropolitana esta área y
businesses,
más que en
churches,
el resto de Carolina
and
del Norte
community
o de Estados Unidos.
organizations have
Hay
been very
muchas
responsive
organizaciones
to the
que han
county's
tenido mucha
stay
respuesta
home, stay safe
hacia
policy,
la política
which has
de
reduced the spread
manténgase en casa,
of this
manténgase a salvo
contagious
para
illness.
poder no propagar
Thus
esta
far,
enfermedad tan
according to Mission
contagiosa.
Hospital,
Y
about 25 residents have
al
been
menos
admitted
24
to the
residentes
hospital
han
who were
sido
determined to
admitidos
be
en Mission
positive for
Hospital
COVID-19. There
a
have
causa
never been
del
more than
COVID-19.
6 individuals at
Han
any one
habido,
time in the
no han
hospital
habido más de 6
who were
individuos a la
confirmed
vez que
to
hayan
have
sido confirmados de
COVID-19,
la COVID-19.
and the number of cases
Y el
has
número
usually
de
been
casos
between 2 and
siempre ha sido
4.
entre 2 o 4.
For this reason, Buncombe County
Por
supports Mission
esta
Hospital's
razón,
plans
el
to
condado de
resume
Buncombe
some medical procedures that had been previously placed
apoya
on hold
al
to assure adequate
la
capacity
hospital de
at the
Mission para
hospital.
poder admitir a otros pacientes por
We
otras
are eager
razones.
to begin the process of
Y
restoring more
estamos
economic
muy
and community
emocionados
activities
de
as
querer
well.
reactivar
must
nuestra
do it in a
comunidad
way
y nuestras
that
actividades,
continues
pero
to
tenemos que hacerlo
prioritize
de una
public
manera
safety.
donde priorizamos la salud
Governor Roy Cooper
pública
has announced plans
y el
for a
gobernador
reopening
Cooper
process for
ha
North Carolina
anunciado
using a phased approach and with
una
scientific
manera de
metrics
poder hacer
that
la
can be tracked
reapertura
to
en
ensure that
3 fases.
COVID-19 remains in check. Today, I will
Hoy
sign a revised
voy a
local
mandar
emergency order
una
that further aligns our county policy with the overall approach
declaración
being
que esté
taken
más
by
alineada
North Carolina.
con la de Carolina del
The
Norte
revisions to the local order
y
today
estas revisiones de la
will
orden
enable the
local para
revised
poder
will
hacer
enable
que
the revised
se
number of people who
revise
may attend a community
el
gathering
número de
from
personas
0
que
to
pueden
10,
estar en una
consistent
reunión
with the North
masiva,
Carolina
que sería
policy
de
and with
0 a
requirements for
10
social
personas que
distancing.
se puedan reunir ahora.
Governor Cooper has
El
announced
gobernador
that
Cooper
phase 1
ha
of
anunciado
reopening
que
could
la
occur
fase
as
1
early
puede
as May
comenzar
9th.
tan
But this is
pronto como
contingent
el
on
9
data
de
to
mayo,
confirm that transmission of
si es que hay
COVID-19
datos
is
que
leveling off or
está
declining.
diciendo que los contagios están
Phase 1 will
bajando o
likely, based on the
se
governor's
están alineando. Y esto ha
comments,
sido
enable
en cuanto
retail
a los
businesses to
comentarios
resume
que
operations,
el
but with
gobernador ha dado
limitations and
acerca de
safeguards.
las operaciones.
Phase 2 of reopenings
La
could
fase
occur within
2
2 to 3 weeks after phase
puede
1,
comenzar después
but
de 2 a
again
3
contingent
semanas
on
que
data
empezó la
showing
fase
that
1.
COVID-19 trends are
Y si
moving
es
in a
que las
favorable
tendencias
direction.
del COVID-19
Phase 2 is
están
likely to
siendo
include some
favorables.
expanded
Y la
operations for
fase 3 tal
restaurants
vez será
with limitations
en
and
cuanto
safeguards.
a la apertura de
One area
restaurantes.
where Buncombe County will need to
Una
continue
cosa
to consider
que
specific
el
limits of
condado de Buncombe
reopening
tiene que
is for leisure tourism.
estar es en
Due
cuanto
to the
al
popularity of
turismo,
Asheville as a
la
tourist destination
popularidad de
and the
que
fact that
Asheville es
many
un
areas of the
destino
country, including neighboring states,
de turismo
have
y
extensive
que
spread of
ahora
COVID-19
algunos
transmissions,
estados
we will need to take a
vecinos están
careful and
reabriendo.
gradual
Tenemos que
approach to
tener
inviting significant numbers of people from
un
outside the region
abordaje
and
de
state
esto con
into our
mucho
county.
cuidado para poder
The current prohibition on
traer
leisure
el turismo,
tourism
pero
will
no
continue during
tanto a
phase
la vez.
1 in Buncombe County, but is
Y
expected to be incrementally
esperemos
relaxed in the subsequent
que
phases.
estas
We hope to
fases
have a more detailed plan that
subsecuentes
can be shared
sean
for resuming
relajadas en
tourist-related
cuanto
activities
tengamos
in the
unas
near
buenas
future.
tendencias y esperemos que podamos reabrir y
I
resumir
want to
nuestras
reiterate my thanks
operaciones.
to all the
Y
people,
quiero
organizations,
dar
and
las gracias a
businesses in Buncombe
aquella gente
County
y
that have helped our
negocios
community
y
stay
socios que
safe.
han ayudado a
It
mantener
has
a
saved
salvo este
lives.
condado. Han podido
If we
salvar
continue to
vidas.
work together, we will be
Queremos
able to
continuar
bring our community
trabajando
back in a
juntos
careful and
y
responsible
poder
way.
hacer una
The
reapertura
county also
del
appreciates the
condado en una
cooperation of
manera
all the
responsable
municipalities in
y
Buncombe County
también
in this effort.
el reducir
Mayor,
las
the mayor of
mortalidades
Asheville,
aquí.
Esther
Y
Manheimer, is with
la
us
alcaldesa
today and would like to make a
Esther
few remarks.
Manheimer quisiera hablar un poco de esto.
Good
Buenas
afternoon.
tardes.
Today, the city
Hoy
of
la ciudad de
Asheville is joining with the
Asheville se está
county
uniendo
in
con el
aligning our
condado,
safe
juntando
stay
esas
home order
normas
with
de
Governor
quedarse
Cooper's
a casa, quedarse a
extension
salvo, con la
to May
extensión que ha
8th.
hecho el gobernador Cooper de
I know
mayo
that so
8.
many of us would
Sé que
like to
muchos de
return to a
nosotras
sense of
quieren volver a
normalcy.
un sentido
Our
de
daily
normalidad, de
routines,
nuestras
our
rutinas
families and
diarias,
businesses
de
have
nuestras
been so
familias
severely
y nuestros
impacted
negocios han
by the
sido impactos
COVID-19
gravemente
pandemic.
por el COVID, por la pandemia del
We have
COVID-19.
seen that
Hemos visto
social
que el
distancing
distanciamiento
and the
social y el
shutdown have had
cierre ha
positive
tenido
health results and
un
are working to slow
positivo
the spread
en
of
el,
COVID-19.
un resultado
We want to
positivo
see those
y
positive
queremos
results
que
continue and not go to
estos
waste.
resultados positivos
In
continúen y que no
response
se
to this public
pierdan.
health
La respuesta
crisis,
pública
our
de
community
esta
has come
crisis
together
sanitaria,
in
nuestra
unprecedented
comunidad
and innovative
se ha
ways.
juntado de una
I have
manera
no
sin
doubt that this will
precedentes e
continue as we move
innovativa y
forward.
yo sé que esto va a continuar
City
según
staff
seguimos
is working
adelante.
closely with
Los
Buncombe
trabajadores de
County
la
health
ciudad están
officials
trabajando muy
to
cerca
follow the plan outlined by the governor
con el
as to how
condado
we can safely
y ver
reopen.
qué pautas seguir para
The
poder
city
volver a
is
abrir con
participating in
las
a
órdenes del
series of
gobernador.
virtual town
La
halls
ciudad
led
ha
by the Chamber of
participado y está
Commerce and
participando
the
en
county
muchas
to hear
asambleas
directly from
públicas gracias a
businesses
la Mesa de
about their
Comercios
concerns and
para
perspectives.
escuchar las
Hundreds have
preocupaciones públicas.
participated in
Cientos de personas
discussions about reopening
han
in this new
participado
normal.
y preguntado sus
This includes
dudas
industry
sobre
groups
este nuevo
like
normal,
manufacturing,
incluyendo
childcare and adult
a
care,
gente que
the
viene de
arts,
industrias, de artes, de
restaurants,
restaurantes, de cuidado de niños, de
healthcare,
cuidado de adultos,
retail, and lodging.
tiendas, hoteles.
I want to
Y
thank our
quiero dar las
chamber
gracias
for stepping up and
a
pulling our
nuestra,
business community
a
together
nuestra mesa de
to work
comercios, de
proactively
trabajar de una
to
manera tan
figure out how we can
proactiva,
reopen
de
in
ver
this
cómo
new normal.
podemos volver a abrir en esta nueva
This input
normalidad.
will help
Esta
develop
información nos
clear
va
and
a
consistent
ayudar a
guidelines to
tener
keep
unas
employees
pautas
and customers safe
para que nuestros
as we look toward
trabajadores y nuestros
reopening
clientes
our
estén a
economy.
salvo y seguros según
While we
vemos
are
cómo
planning for
volver
next
a abrir
steps,
nuestra
our
economía.
number one priority
Mientras
remains
estamos
keeping everyone in our
planeando los
community
siguientes
safe.
pasos, nuestra
I
nuestra
ask for your
primera prioridad
patience as we work
es
through
mantener a
the
todas las
next
personas en
few
nuestra comunidad
weeks.
segura.
Please
Entonces les
continue to
pido
stay home,
paciencia en las
practice
próximas
physical
semanas, que se
distancing,
continúen
and
quedándose en casa,
follow public health
que hagan el
guidelines.
distanciamiento social y sigan
Thank
las
you for
pautas
pulling
sanitarias.
together
Y
as a
muchas gracias por
community. We
juntarse
have
como
made progress,
comunidad.
and we will continue
Hemos
to do
hecho
so.
mucho progreso y vamos a continuar haciéndolo. Gracias.
All right, thank you, Mayor. I'm now going
Gracias,
to
alcaldesa.
sign
Ahora voy
the
a firmar
superseding
esta
declaration for the Buncombe County
declaración
local state of
de
emergency.
del condado como estado de emergencia.
And I'd like to
Y me
invite Fletcher
gustaría
Tove
invitar a
to come up
Fletcher
to
Tove a
talk a little
que
bit more
hable
detail
más
about these revisions and other county planning
acerca
efforts related to COVID-19.
de la comunidad y las respuestas al COVID-19.
Thank you, Chairman
Gracias
Newman,
a
and good afternoon. I'm Fletcher Tove,
señor
Buncombe
Newman
County
y soy Fletcher
Public
Tove,
Health
director
Emergency
de preparación de
Preparedness
salud
Director.
pública.
Today, I'll be
Entonces,
discussing
hoy
the
voy a estar
revision
hablando de la
of the Buncombe
revisión
County Stay
de
Home, Stay
la
Safe order
orden de manténgase
that
en
Chairman
casa,
Newman just
manténgase a salvo
signed,
que
and
el
what we
señor
know
Newman
so
acaba de
far
firmar
about Governor
y
Cooper's
hablar
plan
acerca del
for
plan
reopening the
del
state
gobernador
in
Cooper
3
para
phases.
poder abrir el estado
The intent
en
of this
3
new order
fases.
is to
La
more closely
intención de
align
esta
Buncombe
orden
County
es que se
policy
alinee
with that of the
más
state.
la
So as we
orden
begin Governor
del
Cooper's
condado
phased
con la
approach
del
to
gobernador
loosening
Cooper
restrictions,
para poder
we can move forward in lockstep
facilitar
and match the
las
governor's phases
restricciones
and messaging.
y poder comenzar esta
Going
reapertura en
forward,
fases.
we intend to follow the governor's lead
Esperamos
to the best of our ability
poder
in
alinearnos
reopening
con
our communities.
las pautas del
But we
gobernador
will
lo más
always
que
reserve the
podamos,
ability
pero también
to add
reservamos la
further
habilidad de poder
restrictions in the
adherir
best interest of
más
the residents
restricciones
of Buncombe
para
County.
el interés de los residentes del condado de Buncombe.
Our new order
Nuestra nueva
goes into
orden
effect
comenzará
tomorrow
mañana
at 6
a
a.m.
las 6 de
on
la
Friday,
mañana, el
May
viernes
1st.
1 de mayo.
As we align our orders
Como
today,
alineamos
the
nuestras
biggest and
órdenes
most
hoy,
noticeable change
vemos
is that we are
que
relaxing
vamos a
our
relajar
mass gathering
nuestras
restrictions
restricciones de
to align with the
reuniones
governor's
masivas
current
para
limit
poder
of 10
alinearnos
people.
con las del gobernador de poder
This means
reunirse
that people
con
can get
10
together
personas.
in
10
groups of up to
personas
10, but must
pueden
still
reunirse,
conform to physical
pero
distancing of
todavía
6 feet
tienen que mantener su
and
distancia a
must
6
observe
pies
all other public health
y
guidance
observar las
regarding
otras
hygiene,
guías
sanitation,
de
and the
salud
use of
como
face coverings.
la sanitización y el usar las
This
mascarillas o
relaxation of
tapabocas.
restrictions
Estas
does not
restricciones
allow for non-essential
no
businesses to
permiten
reopen.
que los negocios no esenciales se vuelvan a
We are
abrir.
also again strongly
También
recommending the
recomendamos
use of
el
cloth
usar
face coverings
las
in public
cubiertas
settings,
de tela en
particularly
lugares
when
públicos,
physical distancing
especialmente
measures are difficult to
cuando
maintain.
el mantener el distanciamiento
We know
físico es
that many
difícil.
people,
Sabemos que mucha
possibly
gente,
a majority of
posiblemente la
people
mayoría de la
who have
gente que tiene la
COVID-19 may
COVID-19,
be transmitting the
tal vez esté
disease
transmitiendo
without
la
ever showing any
enfermedad sin ni
symptoms.
siquiera mostrar ningún síntoma.
This is why wearing a face
Es por
covering
eso que
is
tener
so
una
important.
cobertura de la cara es muy
When you
importante.
wear a face
Cuando usas
covering,
una
you
cobertura
are
de cara,
protecting others
estás
from
protegiendo a los
yourself.
demás y de ti.
And when others
Y
wear a face
los
covering,
demás que están
they're
usando sus
protecting you
coberturas
from themselves.
están
So this mitigation tactic
protegiéndote a ti
works best
al
when there's
protegerse
a
a
whole
ellos.
community
Entonces,
buying in.
esto necesita
So we
un
strongly
conocimiento
encourage
de toda
everyone
la
to wear
gente,
face
que
coverings
toda la
in a
gente
public
use
setting.
las cubiertas de la cara en
In
los
the
lugares
latest version
públicos.
of this order,
La
we also
versión
took out some
más
sections that have since been
actualizada
covered or addressed
también
by
aborda
one of Governor Cooper's executive orders,
las órdenes ejecutivas del
namely
Dr. Cooper,
guidance for grocers and retail,
como
which the
las
governor covered
ventas
in Executive Order number 131,
en la orden
and restrictions on
131
long-term care
y las
settings.
restricciones de estos lugares.
Areas where we remain more restrictive than the
Hay
governor
algunos lugares en los que
are
seguimos
that
más
we're still restricting
restringivos
lodging
que
providers
los
from
del
taking
gobernador, es que
reservations for leisure
seguimos
travel.
no
And funerals are still limited
haciendo
to 10 persons.
el
Additionally,
poder abrir
people
los
coming to
lugares
Buncombe
para
County
alojarse,
from outside the
a menos
state
que sean para
must
personas que
still
están
quarantine
trabajando
in their place of
esencialmente.
residence for 14
Y
days
también que las
prior
personas
to
que
entering the
vienen
community.
de otros lugares a este
We also
condado
continue
se
to
mantengan
restrict
en
Governor Cooper's
cuarentena por
clause
14 días antes de empezar
2.c.1 in Executive
las-
Order 121. So that is
el
not
contacto con la
applicable in
comunidad.
Buncombe County.
Y
To be deemed an essential
para
business,
ser
you must be
un
explicitly
negocio
defined
esencial tienes
through
que
that
ser
Executive Order 121.
tienes que estar en la orden ejecutiva
Last
121.
week, Governor
La semana
Cooper laid out a
pasada, el
framework
gobernador
for
Cooper
reopening the state in
habló
3
acerca de
phases
3
to
fases
get
para
us to a
poder
new
reabrir
normal. The
el estado.
timeline of the governor's
Y
phased reopening will be
La línea de
determined
tiempo
by a combination of
será
metrics and data trends.
determinada por las tendencias y
From the limited
métricas
information we
y con
have,
datos. Y
Phase
la
1 may
fase
include a
1
limited
tal
opening
vez
of
comience
non-essential
con
retail
algunas aperturas
continued
de
use of
ventas
face
no
coverings,
esenciales, pero
and
continuar
gatherings
las
limited to no more than
cubrebocas
10 people.
y las
Phase
reuniones
1
que
is
sean
scheduled
de
to
no más de 10
last for
personas.
2 to 3 weeks.
Esta fase puede estar por 2 a 3
Phase 2
semanas.
will
La
see the
fase
governor
2
lifting his stay-at-home order
entonces será de que el gobernador
and limited
quitará
opening
el
of restaurants
manténgase en
and other
casa
businesses,
y abriremos
and limited
algunos
gatherings at houses
negocios
of worship
y restaurantes y
entertainment
otros
venues,
lugares
other
de
public places.
entretenimiento y también
Phase
lugares de
2
fe.
is scheduled to last
Y se
for 4 to
supone que la
6
fase 2
weeks.
es de 4 a 6 semanas.
Phase
La
3
fase
will see
3
increased capacity
incrementará
for
la
restaurants
capacidad
and
de
other gathering
los
places
restaurantes y
to
lugares
operate,
de
and will
reuniones
be our new
y será
normal
nuestro nuevo
for the
normal
foreseeable future.
para el futuro cercano.
This means
Esto
that
significa
according to the
que
governor's current
según
framework, if
las
everything goes
órdenes del
well,
gobernador y
Phase
todo está
3
bien,
will be
la
coming
fase 3
sometime
estará
at the end of June
al
or early
algún
July.
tiempo en los principios
That's
de junio
assuming
o
that we meet all the
principios de
criteria the
julio.
governor has put in place in regards to
Y
metrics
estamos
and data
tratando
trends.
de hacer estas
So
reaperturas
everyone should be in the
dependiendo a los
mindset
métricos y a los
that
datos.
reopening is not a
El
problem
reabrir
for May. It's an ongoing
es una
solution that will
solución
be a gradual
que
process
será
through May,
un proceso
June,
gradual
and July.
de mayo, junio a julio.
As we receive specifics
Como
on reopening
escuchamos
from
de
the
los
governor and the state,
detalles más específicos
COVID-19
del
task
gobierno,
force, we will push that
vamos
information to
a
the
mandar esta
community in
información a
an
la
informative
comunidad de
manner
una
so that
manera
everyone can start their
informativa
planning
para
and
que
preparation
la gente pueda
processes.
empezar el
Thank you.
planeamiento y los procesos de planeación. Gracias.
And now
Y
we will
ahora
hear an
vamos a
update from
escuchar
Dr. William
una-
Hathaway, Chief Medical Officer for
Vamos a
Mission
escuchar
Health.
al Dr. Hathaway que viene a hablar, es un doctor desde Mission.
Thank you, Stacy. I greatly appreciate the opportunity to participate in this press conference today and to do so remotely in an effort to minimize the community spread of the disease. We're trying to restrict all of our own travel, and I hope that this is in one small way an example to the community of how important it is to do that. I want to give a special thanks to those who have spoken before me and all who have been an intimate part of our community's response to the COVID-19 crisis. It's been a privilege and an honor to work with the county, with Dr. Mullendore and her staff, with the commissioners, and especially with Chairman Newman, with the city council, and Mayor Mannheimer, and all those who have been involved in this response. I would like to give a special thanks to the frontline folks who have been intimately involved in the care of the patients and battling on the front lines, exposing themselves specifically to the emergency medical staff who face great personal risk as they approach the epidemic, and to the frontline staff at all of our healthcare facilities, Mission Health included, the nurses, the environmental service workers, the pharmacists, the respiratory therapists who approach this work in truly a heroic fashion. It's been heartwarming to see this. I want to start out by emphasizing that we fully and 100% support the phased approach that has been reiterated here by those who have spoken and by Governor Cooper. While we have meaningfully flattened the curve, I think it is critically important to remember that we have not eliminated the virus. We still have yet to develop a vaccine, and had we not adhered to the stay home, stay safe guidance from Buncombe County and the state, we would be in a far different situation. And for this, I'm grateful to all the citizens in Buncombe County and the surrounding communities who have done their part in making great sacrifices, personal and professional, to keep our community safe. I want to specifically address the issue of resuming or trying to get back to a new normal with respect to the delivery of healthcare services in our community, and by this I mean the 18-county region. As you know, we have been holding off on what have been referred to as non-essential or non-COVID related care. And I think it's important to recognize why we chose to do that over a month ago. Specifically, at that time, we had an unknown wave of patients coming at us, and we were concerned about critical availability of resources, including tests and personal protective equipment. We were concerned about the possibility of not having enough beds, both acute care and critical care beds to care for our patients. We did not want to have patients unnecessarily exposed to the illness. And we were really at a time where we had uncertainty about what was approaching us. And so in an effort to conserve those resources and be prepared for the unknown epidemic, we held off on performing a variety of services. Well, what we've learned so
Y
far,
lo
and
que hemos
Commissioner
aprendido
Newman
hasta ahora
commented on this, we've seen between 20 and 25 patients at Mission Hospital
es
to date,
que en el
which was
hospital
far less than we had anticipated. Our
sí,
elective
nos ha ido mejor
volumes
de lo
and other acute
anticipado.
care volumes have declined considerably, and we have been running at a census
Y
in the neighborhood of
hemos estado
50 to
teniendo
60% capacity. What this means is
en
that
la
we
comunidad, lo
think
que
we have
significa
at this
es
point in time adequate resources to start to provide the
de
care, the
poder
necessary
proveer
care that we
los
had delayed for our patients in an effort to be prepared for the unknown epidemic.
para poder
And so
proveer
we will
las
be
ayuda de emergencia
expanding and
y también poder
ramping up, as
proveer
it
las
were, our
necesidades de
delivery of
contagio de la
imaging
COVID-19
services and procedurally based services
y
and
ahora
office care
podremos tener
over
algunos
time
servicios
in
que
a
se
phased
ofrezcan
approach, much
en
as has
nuestro
been advocated
cuidado
for the phased reopening of our
emergencia
community.
mientras
And
seguimos
these
reabriendo
services will include performing
y poder
a broader array of
tener una
procedures,
variedad de
specifically
procedimientos que
both
podamos
in our hospitals, our
operar
offices,
en el
and
hospital.
in our surgery center. With this, as you know, we have imposed a significant
Y
restriction on access for visitors
poder
to the
tener
hospital.
un
And in the
poco
interest
de
of
mayoría en el acceso a los visitantes,
being stewards of the
pero
community and not exposing
siendo
people to
buenos miembros de la
unnecessary
comunidad
risk, we will continue to have
y
what we refer
manteniéndonos
to as
salvo
level 3 restrictions in place
y que
for
entendamos las
most of
restricciones
our
que están ahora y tal vez las que
patients at
vayamos
the
a crear.
hospital, with the exception that there'll be some minor variations for patients who will be receiving procedures. When those procedures
Pero
are scheduled through your doctors and your doctor's
estos
offices, the
procedimientos
details will be
tienen
relayed
que
to you. But I
venir
want to
de
emphasize that
las
while
guías
we
de
think it's
sus
critically
proveedores de
important to
atención médica
provide the care that was delayed, the necessary
para
care that
poder
was delayed,
brindarles el
in no
cuidado.
way do we think we're, as to use the colloquialism, out of the woods on this one yet. I think it's important to
importante
reassure the community that
entender la
hospitals
comunidad
are a very safe place to go.
y
I
saber a
had
dónde
conversations with my
podemos
colleague
ir,
at
a qué lugares de atención
the
médica y
Party UNC system, Dr. David Ellis, and at the Advent system with Park Ridge Hospital
y también
with Dr.
otros
Teresa Herbert this morning.
hospitales
And
como esta mañana para
just
allí
as we are increasing our provision of care, so are they. And we want to all
queremos
reassure the community
todos servir a la
that it is a
comunidad
safe place to go. We have means and methods to protect
para
patients
proteger a
from
los pacientes
being exposed while
para
in
no
the
estar
hospital. And it is far
expuestos
more
al estar
dangerous
en el
to
hospital
delay care than it is to come to the hospital to get
y
needed
puedan venir
services.
al
And this
hospital
not only
por sus
applies to
procedimientos
the
y
services that we're going to resume,
no
but
hay
it
demasiados
applies
servicios que vamos a
perhaps even more
poder
importantly to emergency
asumir
services.
ahora,
One of
pero
the most surprising things that I've
una de
seen
las
in the
cosas más
course of this
importantes que hemos
crisis
visto en esta
has
crisis
been a significant and frankly unexplained decline in our overall
sido
emergency care volumes, specifically as it relates to some of the most acute care that we
el cuidado
provide.
que hemos proveído
By that I
que ha
mean heart
sido
attacks and strokes as examples. Across the state,
a
patients
través
coming
del
in for acute
estado
heart attack care has dropped in the nature of 30 to 40%.
del 30
And
al
we are
40%
gravely concerned
que
that
hemos estado
patients
preocupados
are
que nuestros
avoiding and
pacientes
delaying potentially life-threatening care
estén
in order
con
to
una
what they
enfermedad
believe
que
is
sea amenazante para sus
avoid an
vidas,
exposure to COVID-19. I can emphatically
como
and
la
without
COVID-19.
hesitation state that if you are having acute care
Pero si
issues, be
están
they
en
related to your cardiac system, neurovascular system, heart
las
attacks or strokes,
emergencias, si tienen
breathing,
problemas
that
para
it is
respirar
far
o si
more
tienen
important for you
problemas
to come to the hospital to get that emergency
corazón
care than to delay it.
y vienen a
And
las
then in closing, I'd like to just comment on
emergencias
one issue that came up in the press recently. It's regarding the treatment
y
of
quieren un tratamiento
COVID-19, and I
y
think
no
many are aware
relacionado con la
that there was breaking
COVID-19.
news yesterday about the use of the drug
Ayer
remdesivir.
estuvimos
Remdesivir is a medication
hablando
administered to
de
patients with COVID-19. It has been shown in a reasonably and well-conducted trial to
maneras
decrease
que
the duration
hemos
of
tratado de
symptoms for
mitigar y
patients
de
with
hacer que la
COVID-19 from an average of
COVID-19
15 days down to 11
no se
days.
propague y
And there
hemos
is
visto
a trend and a tendency
varias
for this
tendencias que
to maybe even have a
algunas
benefit in
personas
saving
se
lives.
recuperan en 11 días.
And we are very encouraged by this. We will have availability of this admission as needed for patients who
Queremos que
qualify
todos
for its
sepan que
administration.
en Mission
But I want to emphasize that while
estamos
this is
enfatizando
the first treatment that we've seen that has proven in a
que
clinical
hemos
trial to have a
mejorado.
benefit, it is by no means a panacea or a cure or a game changer in terms of how we
Y que
deal
ha
with
sido
this illness.
todo un
We are
cambio.
still critically dependent on the physical distancing that all have mentioned before, and I want to encourage patients
Y
or encourage community members
poder animar a la gente
to
de la
continue
comunidad
to adhere to the guidelines
a
as we
continuar
phase out of
ayudando
the restrictions
y
that have been
adhiriéndose a
put
las
into place.
medidas.
Thank you.
Gracias.
In closing,
Para
we have
terminar,
a request
tenemos
from our nonprofit partner,
una
United Way
petición
of
de
Asheville
United Way
in
de
Buncombe
Asheville
County.
en el condado de Buncombe
There are needs
y
in the
quieren,
community
hay
for cleaning
necesidades en la
supplies,
comunidad para materiales
non-perishable
para limpieza,
pantry
artículos de
food
comida
items,
no
hand
perecedores,
sanitizer,
gel antibacterial
and there's
y
also a
también
need
una
for
necesidad
individuals
para
or
personas
businesses
o
with the
negocios que
ability to
tienen la
provide
habilidad de
supplies
proveer
or the ability
algún
to sew
suministro para
cloth
poder
masks.
coser cubrebocas
And
de
if you
tela
have
y
the
tienen
ability to
la
provide
manera
these
de proveer
items
estos
or provide the service,
artículos o el
please
servicio, por
visit
favor visiten
handsonasheville.org
handsonasheville.org
and click on the
y
COVID-19
háganle clic
page.
en la página
And once you're there, click
COVID-19
on the I'll
y
give in-kind
le pueden
donations
poner en
button.
el botón In-Kind
We will be
Donations,
back
donaciones en
with our
especie.
next community
Tendremos
update
nuestra
on Monday
próxima
at 2:30
ampliación
p.m.
el lunes
Thank you.
a las 2:30 de la tarde. Gracias.